I've had the privilege of having worked in the health service and also having been a local councillor, so seen both sides of this. And I think that local authorities are quite sharp organisations. It's quite a different environment and will feel quite different. But I do think that they will be able to be independent. I don't think there is any concern about that. And what's actually going to be very, very important is that evidence base. To affect change, you need that social and economic change. You need political will behind it. With the directors of public health, who I would like to see as real leaders within local authorities. That was in the comprehensive spending review, the money to increase the health visiting workforce by 50%, which I think is absolutely critical. At some point, you have to punch into people's lives. And there is no better place really than when new babies are born. It's the one time some of them will come into contact, and it might actually be the only time, is when they have a baby.
Some of this is an art as much as a science, and getting things like the baseline spending by PCTs isn't straightforward, but we are committed to getting it as right as we possibly can, and indeed engaging local authorities, because they will be receiving these new functions, and they will be very vociferous if they feel we've shortchanged them. Obviously public health is a slippery concept, so I think we will try and give direction, but I think we also need to have a balance of innovation as well. Well, I think we are looking at how we can best share outcomes, and one of the consultation questions was around about this whole issue. And I think one of the things we're doing at the moment is looking, as I said, at the integration of the three frameworks, because people are looking at them as three distinct frameworks, where the intention is they actually are sort of complementary. Generally, people said they were enthused about the idea of incentivising improvement, but they then understandably said, and you will need to be wary of a number of issues, including population churn. So in designing the final version of the premium, those points will very much be in my colleagues in finance's mind.
Absolutely, that was my very first comment about the health premiums. So this is progress towards, so this is about adding value. You will be rewarded on the value you add, not the absolute place that you end up. So we want to incentivise places to do more, as I say, about those inequalities. What works best, and this is true on on many of the responses we've had on education and training, that you need to move alongside people. So we will be developing that with people. We've had some consultation, but the NHS Future Forum made clear, I think we probably knew it already, that we need to move at a slower pace with that. Not least because, as somebody on the Future Forum said, the one certainty about workforce is that it's very uncertain.